The most common cause of lower back pain is what is identified as being a lower cross, which is a postural deviation in which you have tightness in front in the hips, tightness in the lower back, which causes an anterior tilt of the pelvis, which further tightens in the front, tightens in the back, and causes a lengthening and loosening of the abs and the lengthening and loosening of the hamstrings. And this causes problems further up the kinetic chain and tightness in the lower back, which then makes the problem into pain. So what we're going to do is identify how to strengthen, strengthening the abs and strengthening the glutes is a separate kind of course of action, but what we can do is lengthen the muscles in the front and lengthen the muscles in the back. Now to do that, the first stretch we're going to do is adopt a deep lunge, which takes the leading knee above the leading heel, and what we're going to do is create an anterior tilt, which means we're going to tuck the pelvis underneath, and we're going to squeeze this right glute. So imagine that your pelvis was a bucket, and we're going to try and fill the bucket with water and keep it level so we're not spilling out the front or the back. So a neutral pelvis, and we're just going to lean forwards into the stretch for 15 seconds. Once you've got that, if you want to make that stretch more intense, you can then reach the same hand as the trailing leg up to the ceiling, and you'll feel that opening all the way up the side of the body here. If again you want to make that stretch more intense, you can then reach behind and grab the trailing foot, and again squeeze that trailing glute and try and tuck the pelvis underneath, keeping the hips underneath you. So you should feel that stretch at the right side of the body. Okay, so again, 15 seconds on both sides, tucking the pelvis under, and again, if you like to, reaching up for the ceiling, which will give stretch to all the obliques and all the musculature on the flank of the body, or if you want to, you can reach behind and grab that trailing foot, and again, tuck the hips through and keep the hips underneath you. Okay, as I mentioned, the glutes get weak, but when they get weak, they also get tight. So it's important that if you're going to strengthen the glutes, you should also try and keep them nice and at length. So to do that, the best stretch for that probably being pigeon pose, which is when you draw the leading shin across the front of the mat, parallel to the front, and we're going to keep that trailing leg straight and sink the weight forwards over this leading leg. As with all of these stretches, you're going to want to find a deep belly breath, which will mean that your body will essentially relax into the stretch and find new length. And that is partly muscular, but it's also partly neurological, in that we're teaching your nervous system what full length actually is. So again, 15 seconds on either side. These stretches don't have to be held for 15 seconds. If you feel you have tightness in an area, feel free to stay in a pose for 30 plus seconds. If you feel comfortable in these stretches, you can lower down onto the forearms, trying to pull the belly button slowly down towards the floor, lowering the chest over the leading leg. Brilliant. So, there are many stretches for the glutes. Another good one is to lay back and cross one shin over onto the opposite thigh and keep putting the hips on the ground and the shoulders on the ground. You can interlock the fingers behind the straighter leg and pull the knee into the chest. If that feels tight, then you can stay there. If you feel you can get more length, you can interlock around the shin and again draw the knee into the chest. 15 seconds on either side. Trying to keep that hip low on the ground and eventually get into parallel with here. You'll find that you might start off here, but eventually when you get to length, you should be parallel here. So again, 15 seconds on either leg. Finding that deep breath. In that moment, you're just going to try and find that sticky spot. You're not necessarily trying to break ground. This is a stretch that should be done over time, and even something to be done once or twice a day if you're trying to rehabilitate back pain. Okay, excellent. The next stretch is called the pretzel, and what we're going to do is we're going to draw the right leg over the left, and now with the right hand we're going to grab the left foot. Now the other hand can just grab the top knee and let them both drop to the left side. Keeping both shoulders down, looking to the opposite side, and just placing a gentle amount of pressure on that top knee, pulling yourself to the side. You should feel the opening on the flank, so the outside of the hip, the glute medialis. If the glute medialis gets tight, then you can get a whole world of problems higher up the chain. So again, 15 seconds on either side. So left leg over right, left hand into the right foot, let the knees drop to the right side, look to the left, and just gently peel that knee down to the floor. Finding that belly breath. Trying to breathe deeply towards the pelvis, expanding the belly in 360 degrees, front and back. The last stretch we're going to do for the glutes is to rock up into essentially a cross-legged position. From here we're going to take one leg out and the other leg in perpendicular angles, so a right angle here and a right angle here, and instead of leaning out here over the leading leg, we're going to lean 45 degrees away, keeping the chest high, which is going to gently peel down to the floor, so just keeping the back nice and straight. You should feel that stretch on the outside of the right hip here. The muscle that doesn't get stretched very much, the piriformis. And then to get to the other side, all you have to do is rotate the hips and lean to the opposite direction. So again, not 90 out here, but leaning 45 degrees out, back straight, and leaning the belly button down to the floor. Brilliant. Back to the centre. What we're going to do is some work for the adductors. People might not realise, but the adductors have a function in sort of squats and things in which we are getting to 90, they help you power out the squat, which means if you're going to do leg intensive days at the gym, or otherwise, if you're not going to do any kind of training or any stretching in these muscles, then they're going to, if they get tight, they're going to prevent you getting to depth, which means you're going to start using the musculature more in front of the hips, which will then further exacerbate your problem in lower cross. So what we're going to do is firstly, just draw the heels in close to us in butterfly, interlocking the fingers around the heels, toes, and drawing the heels towards us, shoulders back and down away from the ears, finding that comfortable position, sinking into the position. And what we're going to do is we're going to inhale into the belly, reaching upwards, and then exhale, sinking the hands forwards, reaching forwards to that point of discomfort, that sticky spot. We're just going to stay there for 15 seconds. Once you're done there, we're going to move to child's pose. So we're going to take the knees out, we're going to take the toes together, and we're going to send the hands to the front of the mat and the belly button down towards the floor, reaching the hands as far forward as you can. If you don't feel the stretch in the adductors and the insides of the legs, you can then split the legs further apart. Really trying to lengthen the spine here and lower the belly button towards the floor, lifting the chest high and reaching the hands forward. Once you've found that length, you can take the hands under shoulders, knees under hips, and what we're going to do is we're going to reach one hand up to the ceiling, making a big gap between the hands, and feeling the stretch all through from leading knee or from the right knee up to the left hand on this occasion, opening up the obliques, some of the muscles that will compress the spine down here, and also opening up the inside of the leg. So Changing sides, reaching up, again making big that gap as big as you can between the hands. And back down. Excellent. Other stretches include the bird, the cat-cow, which is very simple. We're just going to tuck the pelvis underneath, lift the chest, look to the ceiling, and then reverse, so tucking the pelvis underneath and pushing away with the hands. Just finding extra length throughout the spine. Trying to breathe into the belly, stretching the abdominals, and then reversing that. And possibly the most accessible stretch to decompress the spine is just simply an overhead reach. So this is a very useful stretch to incorporate into daily practice in the morning, on the bus, whatever. All we're going to do is just reach up, inhale into the ceiling, hands on top of each other. Exhale, reaching to one side. Inhale to ceiling, exhale to the other side. Possibly the most accessible stretch there is, and yet one of the least performed. Really useful. Again, if you want to cross the elbows over, all we can do is inhale centre, exhale, lean to one side, rotate and feel that stretch up the flank of the body, throughout the spine, rectus spinae, all the muscles in the back, all the muscles that may get tight and cause compression in the lower back. Amazing. Hopefully that helps. And yeah, like I say, this is the most common cause of lower back pain. It's not the only cause of lower back pain. So it's not a cure-all, but it's probably the most applicable stretch routine I could give to you guys today. Thanks a lot. And I guess, hasn't filmed any of it. Oh, I did film it.